former health minister has admitted that doubling NHS spending over the last 17 years has had no impact on the nation's health.
Well, Lord Bethell, a Conservative minister under Boris Johnson, warned that Britain is facing a social, moral and economic disaster because billions of pounds are being wasted.
The peer claims spending has doubled in the last 17 years on the health service, from 100 to 200 billion pounds.
Well, joining us now in the studio is former political advisor Charlie Rowley. Morning to you, Charlie.
Good morning.
Is Lord Bethell right when he talks about wastage in the system?
Well, I think you can talk to anyone who will agree and acknowledge that there has been, in any system, in any organisation, that gets too big or is a big organisation, you're always going to get wasted funds. And I think what Lord Bethell was pointing to is, on some occasions, there are people that, I think 1 in 6 who are currently in a bed in hospital could have been discharged earlier, that might not necessarily need to be there. So that adds to the costs. Where in certain cases taxis are delivering medicines to patients maybe 1 or 2 days earlier in order to get there, when actually patients could go and collect them from their local pharmacist when it gets delivered. So there is a lot of spend that can be whether cut or reinvested in the NHS. I think people are fully aware of that. So there is a case that he makes, but I don't want to take away from the heroic efforts that I think most people can acknowledge of those who work on the front line of the NHS, at the very least, who do an amazing job.
No, I mean, also with this one, I mean, it sounds quite startling when you say, well, we're spending twice as much money, but over 17 years there's been significant inflation. Where money is being spent is going to vary over that period of time, whether it's on equipment, staff or anything else. It's not to say there isn't wastage, but there will be some reason for an increase in spending, because there always is.
Yeah, exactly so. And I think, looking to the future, we do need to look for ways in which we can increase our preventative medications to make sure that people actually don't end up using the NHS where they don't necessarily need to. We might need to even look at alternative ways to deliver health for this country. So whether it's really separating out mental health, for example, as opposed to just going to your A&E department or using the NHS, whether we have to really think about social care and adult care in the long term, because that is where I think an awful lot of money will need to be spent. But the trouble is, it's just how do you actually deliver that, and who and who is best to do that. And I think, everybody just wants an NHS that runs smoothly, that runs where you can use it at the point of delivery, where you can turn up. It is the bedrock of one of our great things about our country, is that if you do fall ill, you can go and see a nurse or a doctor, but you want it to be efficient and timely. You don't want, as a UK taxpayer, to know that your taxes are going on an organisation or a body, whether it's the NHS itself, and that money is being wasted.
A lot of this feeds into what Wes Streeting has been talking about, which is the need to modernise the NHS. I mean, reading here, the NHS is really vulnerable to fraud, apparently, losing a vast amount of money to cybercrime, and things like taxis, getting people home in taxis, and what was the other thing that I just spotted here? And looking after, preventing ill health rather than treating ill health once it happens. If you are funding somebody with a chronic illness for 40, 50 years of their life, that's obviously going to cost a lot more than trying to prevent it in the first place.
Using the internet without a VPN, a virtual private network, is a bit like taking to the road without car insurance. All it takes is one unlucky moment to cost you a lot of cash. This video's sponsor is Private Internet Access. They are the VPN to help keep you safe. Click the link in the description below to find out why over 30 million people have downloaded PIA to protect themselves online. A virtual private network is an app that hides your IP address and helps keep your data private. When you're browsing the internet at home, you give up a large amount of data to businesses, to shops, and indeed to social media giants too. Hackers have the ability to steal your personal data with ease, including sensitive information such as passwords, keystrokes, and even your personal photos. Private Internet Access helps protect your personal data by encrypting your internet connection to keep your data out of the hands of cybercriminals. And it's not just hackers either to be concerned about. Information can be censored too. When Canada passed their C18 bill, social media giants decided to ban news content on their platforms. But PIA can protect your ability to consume the news and content you love. Private internet access is available for Windows users, Mac OS, Android, Linux, iOS, and you can use one PIA subscription to protect an unlimited amount of devices. And we've got a huge GB News discount for you too. Click the link in this video's description and you'll get a massive 83% off PIA. That's under £2 a month, the price of a coffee, and you'll get an extra 4 months completely free on top. Also, there's a 30-day money-back guarantee too. Visit piavpn.com/GB News to start protecting yourself digitally today.
Oh, absolutely. And I think, look, there really does need to be a bigger conversation with the public about just how we live in general. You know, we are an ageing population. We are living longer. That means that more people will come into contact with the NHS. So whether it is about having healthier and happier lives where you don't have the contact with the NHS, to eating healthier, going to the gym or doing exercise, which Gen Z, I think we're on now, are we? Is it Gen Z, Gen X? Who are the latest?
We're an alpha.
We're an alpha now.
Alpha,
you know,
aren't
the kids, they don't drink, they don't smoke, they don't have fun these days. You know, they barely breathe themselves.
But they might be healthier.
It's a fortune. So, you know, there is a new generation of people, I think, coming forward that will have a different lifestyle compared to maybe people who...
You.
me. But I don't
the likes of us.
But I don't have kids, and I'm very happy for it, which I know is obviously...
One of our debate later on, do kids make you miserable? We can't possibly comment. All right, Charlie, we'll see you in a little bit. Thanks
Charlie.
very much indeed.
Now, at 16 minutes past 6, let's take a look at some other stories.
And that's the question, because, you know, for far too long, everybody loves the NHS. Of course we do. We know that it's there to help us, you know, whenever we need to, because we're entitled to it, and it's just a part of the UK and British DNA. There are some fantastic stories that come out of the NHS. We always praise the people that work on the front lines, and absolutely rightly so. But when an organisation does get too big, and you hear stories from experts, as I would say a former minister is, to know an awful lot about it. He's got nothing to gain by saying what he said today. We have to sit up and listen, and we have to see where the money goes, how it can be better spent, what waste, where there will always be waste in a big organisation, where that needs to be cut, or where it needs to be reinvested, and how you can actually ensure that there is the delivery for patients.
It does raise questions, though, doesn't it, about something becoming too big, because it's very, very hard to reform. Because 17 years, we're talking... Well, we're talking initially the end of Labour, we're talking about the coalition, we're talking about Conservative government, and we're talking about the new Labour government. So it's every sort of possible colour you could think of.
Yeah, and everybody will have an idea as how it can be better organised, how the NHS can deliver for everybody. And so whether it's more spending, I think people are at their limit, actually, when it comes to more spending. I think everybody recognises that actually...
Well, it's well funded.
It's very well funded, and it does get increases year on year. You know, David Cameron, I think, when he was Prime Minister, said he wanted to ring-fence the budget on the back of coming into office in that coalition, as you rightly said. But a lot of it, I think, is about actually, you know, can we get a panel of experts? Can we actually get the medical profession? Because everybody says the system, it does need a bit of work, or a bit more than a bit, but it needs a lot of work. So let's actually, for the first time now, think outside the box. Can we get a panel of experts, clinicians, the medical profession, people that have worked in the NHS, people that have been patients in the NHS, people that have seen the best of it and the worst of it, to actually get together and say, right, this is what really we think, as those at both ends of the spectrum, can really deliver for patients going forward. How
much of this spending, especially in the last 3 years or so, has gone on resident doctors and this huge pay rise?
Well, that is part of the claim that Lord Bethel is making, that, you know, with the increased salaries and obviously with strikes that we've seen, that would only add to the bill, because there'll be a backlog in the NHS that's ever growing. I don't know how much that is in terms of the doubling from 100 billion to 200 billion. Probably not all that much, but every penny matters. And, you know, when you are waking up in the morning, when you are hard-working Brits, when you're tuning in to GB News, either on the telly or on the radio before you go to work or on your way to work, you want to make sure that your taxpayer money is being funded properly, it's being funded appropriately, and it's going to the doctors and nurses on the ground, not maybe consultants or middle management. You want it to make sure that it's going on the investment in technology that you talked about just now, Stephen. You know, we know AI is... we know all about AI. We can't stop talking about it, But how can that come
But there
on
are
stream?
benefits of AI in the medical field.
Exactly. So how can we utilise those benefits to then actually bring down the bill of the NHS where money is currently being spent, where it could be spent on technology and the future of AI, in order to make sure that waiting lists come down, patients get the treatment that they actually want and deserve? How can we invest a little bit more to save the NHS by people having happier lifestyles, healthier lifestyles that prevent them going into the NHS in the first place?